Welcome again. Glad you could join us. This is the Minority Health Report with Dr. O. I'm your host. Today we're going to discuss a very important subject, high blood pressure. What is it? How did I get it? Now that I have it, what do I do about it? So stay tuned as we get started. Okay, what is high blood pressure? First of all, before we go into all of the conversations, perhaps we should define what blood pressure is. What is normal, what is not normal. Okay? So, there are two components to blood pressure, the systolic and the diastolic. Systolic is the upper number, diastolic is the lower number. What do those mean? Okay, when your heart pushes blood out, the force that it generates during systole, in contraction of the heart, makes up the upper number of your blood pressure. After the heart relaxes, the residual pressures within the system is the diastolic pressure. So your blood pressure is made up of an upper number, which is the systolic, which is generated when the heart squeezes out blood, and the diastolic, which is the lower number, which is generated at the height of relaxation of your heartbeat in between cycles. Now, normal blood pressure is said to be 120 systolic and 80 diastolic, or anything below that. That is textbook classic normal blood pressure, 120 over 80 or anything below that. There's a range from 120 to 129, 130, where it is now at risk, right? Nobody will put you on treatment when your blood pressure is 129. However, we begin to see that once your blood pressure starts to go up that way, then your risk for developing high blood pressure increases. Also, as we go on, as we get older in life, your systolic blood pressure again is the upper number. And by the way, most of this talk is going to focus mostly on the upper number because we use that as a reference to what's going on in your body. It doesn't mean the lower number is not important. It is important. But most times we start to pay attention when your upper number is going high. So between 130 and 139, this is an elevated blood pressure, right? That's when your doctor will start telling you to do things to change your lifestyle and what have you. Anything above 139, by the time you hit 140 and above, you have high blood pressure. And at that time, you will need to start active intervention to take care of your blood pressure. Okay, so we've established that basics. 120 over 80 and below is considered normal. Your systolic between 120 and 130, 129 is at risk, not necessarily bad. From 130 to 139 is elevated blood pressure, and then high blood pressure is defined as any blood pressure above 139 systolic. If you want to know about the diastolic, it's also 89 is a cutoff for your diastolic blood pressure. So 139 over 89 is considered high blood pressure. What are the risk factors for blood pressure? There's a lot that contributes to us developing blood pressure. A lot of times, some of the risk factors are unavoidable. For instance, age. The older we get, the more likely we are to develop blood pressure. Family history. If you inherited it in your genes, you're not very likely to get away from it too much. There are things you can do to modify, but you may not get away completely from it. Race. If you're African American, if you're black, you're at higher risk for both developing blood pressure but also having more complications, as well as in blacks and African Americans, you're more likely to develop blood pressure at a younger age than the rest of the population. So these are unavoidable risk factors: age, family history, your race. But overall, the most prevalent risk factors for developing high blood pressure are actually quite avoidable. Avoidable or preventable factors include obesity, includes physical inactivity, includes a habit of eating high salt content food. Whether it is the salt you put in your food as you cook it, or a habit of always eating high salt content food. I don't care if it's your movie theater popcorn, your snacks, or preserved foods like pickles and what have you. Those over a period of time increase the salt load in your body and would increase your risk for blood pressure. Now that we've defined that, what is the problem with blood pressure? How prevalent is this? Well, it turns out that about 50% of Americans actually have blood pressure problems. 50% of Americans. If you put that in numbers, that's way more than 110 million people in this country today living with blood pressure. Of this number, about 25% of people have their blood pressure well controlled. Most other people walk around with blood pressures not well controlled. I can attest to that because a lot of my patients, especially new patients, come to me and say, well, doc, my blood pressure has never been well controlled. That's how I am. And I always respond and say, well, if your physiology is the same as mine, if you're human like mine, well, here is a target for control, and this is what we need to shoot for. So psychologically, a lot of people get used to the fact that their blood pressure is high and they say, oh, well, that's how it is. That's what I expect. I don't expect better. I'm asking you today to demand better if your blood pressure is not well controlled. So think about that. Only 25% of people have their blood pressure well controlled. A lot of people walk around not knowing they have high blood pressure. I remember a dramatic case many years ago. A young man, I think he was going to sign up for the police academy or the Marines or some protective forces, and came to me for his physical. His blood pressure was through the roof. The first visit in a lot of years. He was only 27 years old. I did his blood test and I realized he was in kidney failure. He went from my office to the emergency room to dialysis. In 2 or 3 days, he was receiving dialysis. He was in kidney failure. He didn't know it. He came to me to get a physical to go to join the protective services. Little did he know he hadn't protected himself through the years. He was only 27 years old. How could he suspect that he was that badly off? So there's a lot more people that have undiagnosed high blood pressure than people that actually do know it. And for the people that know it, only 25% of people have target control on their blood pressure. The reason we fuss about blood pressure, yes, of course, the numbers can be scary, the numbers can be upsetting, but there's a reason where we fuss about blood pressure. The complications that can come from uncontrolled blood pressure are very many. So with blood pressure, with diabetes, with all these other diseases, there are things we call target organs that get affected when it is not controlled. With blood pressure, the target organs include your heart, your kidneys, your brain. So we fuss about blood pressure because of the damage it can do to your target organs. Because of increased pressure environment, as the heart continues to pump blood, the muscles of the heart can get thickened. The heart can fail because it gets tired of pushing against blood pressure, right? For your kidneys, same with your kidneys. As your blood vessel, as the pressure inside your blood vessel increases, perfusion of the kidneys reduces, and because of that, the kidneys lose blood circulation. Remember, each organ in your body also needs its own blood supply, and a lot of these organs depend on passive flow of blood through its own vessels to nourish it. So when the pressures within the system have gone beyond a certain threshold, that passive flow of blood into the tiny little arterioles become compromised, the organs don't get nourished, and we get kidney failure, heart failure, or God forbid, a stroke. So these are the reasons why controlling your blood pressure is important. All right. The most important things to think about that we can control on a day-to-day basis is our lifestyle, our food intake, and our physical activity. Of course, things like chronic stress also contribute to developing blood pressure. Of course, poor access to health care also contribute to, especially poorly controlled or undiagnosed high blood pressure. But when we've gone beyond that, those impediments, The next thing would be when you actually go to your doctor to understand what the target of control for your blood pressure is. One of the challenges I have with patients is people that come in and they ask me all the time, Doctor, oh, why do I need to take 2 medicines? My cousin only takes 1 medicine. Doctor, oh, I'm taking 3 medicines or 4 medicines for my blood pressure. My neighbor only takes 1 medicine. All blood pressures are not created equal. Some people will come to me, and as soon as you give even half a pill, pressure comes down to, remember what the target is, 120/80 or below. So your doctor is not really in charge of how many medicines it takes to bring your pressure down. This is how I talk to my patients. I'm not in charge, you're not in charge, your body tells me what to do. So if this was a boxing match and I'm throwing punches and you're not going down, all I need to do is wind up and throw a bigger punch. If you don't go down, I wind up and throw another one. So if that is in boxing, it's the same thing we're doing it with blood pressure. I give you 1 medicine, I give you the second medicine, and I watch your blood pressure. I adjust the dosages and I watch your blood pressure. Until your blood pressure comes down to target, we can't stop treating it. And you can't say because I'm taking 1 medication, everything is A-okay now. Okay? Now that's an important thing to remember. Target for blood pressure treatment is 120/80 or below. In the elderly, it can get a little tricky because the elderly can tolerate a little higher blood pressure, because the more you want to push it down, they might start to get dizziness, something we call positional dizziness or positional hypotension. You don't want your elderly loved one to lose their balance and fall, especially when getting up from a sitting position or a lying down position. So that's a special category, and at a later video I will discuss those details, those fine points. But generally speaking, we want your blood pressure 120/80 or below. Complications of blood pressure, I already mentioned it. Congestive heart failure. Eventually, that heart that is beating against increased pressures might give out on you. You start to get shortness of breath, you start to get swollen legs, you can't walk up a flight of stairs and things like that. Heart disease in African Americans is a very important complication when it comes to blood pressure, because in African Americans we die at a higher rate and we get these complications at a much higher rate than everybody else. Stroke, kidney failure. We must take care of our pressure to prevent the development of these complications. Now, the truth is, whenever these complications have developed, we can actually treat and manage it and maybe pull you back from the brink. But the idea is not to get there first. This is why talking about it, treating it early is way more important. How does that word go? An ounce of prevention is worth more than a pound of cure, or something to that effect. We identify our blood pressure early, we treat to goal to prevent complications, because treating the complications can get complicated. The most important avoidable factors for developing blood pressure, for that matter, even if you have developed blood pressure, the most important factors that help control your blood pressure: excessive alcohol intake, physical inactivity, obesity, high salt diet. We can actually do something to help these. Okay, that's our talk for today. High blood pressure is very important. The cost of blood pressure is very high. More than 110 million Americans are dealing with blood pressure today. We can all do something about it, particularly for ourselves. Remember, the target blood pressure is 120/80 or below. When you're taking medications, make sure you check your blood pressure, make sure you're hitting your target goal. All right? Thanks for tuning in. Dr. O with a Minority Health Report. Please click the like button below, please subscribe, and please share with others. Thank you, and see you on the next episode.